This video will cover first aid for wounds and bleeding, providing essential knowledge for first responders. A wound is an injury where the skin is torn, cut, or punctured. It can also be a contusion caused by blunt force trauma. Wounds can be classified based on their cause, location, type of injury, depth, tissue loss, or clinical appearance. Wounds are broadly categorized as closed, resulting from blunt trauma, or open, resulting from penetrating trauma. Remember, wound depth is more critical than the area. Open wounds expose underlying tissue, making them vulnerable to bleeding and infection. Types of open wounds include incised wounds, lacerated wounds, abrasions, puncture wounds, gunshot wounds, avulsions, and amputations. This illustration shows various types of open wounds, including abrasions, lacerations, avulsions, incisions, punctures, and amputations. Abrasions are shallow, irregular wounds with minor bleeding. Lacerations are tear-like wounds, deeper than abrasions, causing more pain and bleeding. Incisions are linear, sharp-edged cuts, often from surgical procedures or sharp objects. Punctures are small, rounded wounds from sharp, pointed objects. Gunshot wounds are penetrating wounds caused by firearms, which may have burn marks depending on the distance fired. Closed wounds, or blunt trauma, include contused wounds, which are essentially bruises or contusions, resulting in damage beneath the skin. Closed wounds result from direct blunt trauma, such as falling. Even with intact skin, the damage can extend to underlying muscle, internal organs, and bones. Dangers of wounds include bleeding and infection. First aid aims to stop bleeding and minimize germ entry. Germs come from the wound-causing object, hands of the first aider, patient's clothes, dirty dressing, air, and contaminated water. Management involves controlling bleeding, gentle handling, washing hands, removing foreign bodies if possible, not removing embedded objects, not disturbing blood clots, applying a clean dressing, and shifting the patient to a hospital. For wound management, first wash your hands. Check the wound for foreign matter. If dirty, clean it under running water. Pat dry with a clean, non-fluffy material. Clean the wound using gauze or antiseptic wipes, moving from the center out. Cover the wound with a dressing and elevate it to control bleeding, if needed. Now we will focus on bleeding. What are the different types of bleeding? Bleeding results from the rupture of blood vessels. There are two main types of bleeding: external bleeding, which is outside the body through a break in the skin, and internal bleeding, which occurs inside the body when blood leaks from vessels or organs. Classification of bleeding includes arterial bleeding, where blood comes from an artery. It is bright red, comes in jets corresponding to the heartbeat, and blood loss is rapid and profound, capable of causing death quickly. Venous bleeding comes from a vein. The blood is dark red and flows as a continuous stream, which may also be profuse. Capillary bleeding comes from capillaries. The blood is slow and oozes. It is less red than arterial blood and is generally not serious. The dangers of bleeding include shock and infection. Shock can occur from severe blood loss, and infection risks increase with any break in the skin. First aid aims to stop the blood loss, remove germs, and prevent shock. The management for bleeding includes minimizing the risk of infection, gentle handling, and keeping the injured part at rest. To control external bleeding, apply direct pressure on the wound using a clean dressing. Elevate the injured part above the heart, if possible. For severe bleeding, apply pressure to the nearest pressure point to compress the main artery supplying the area. If the direct pressure is not sufficient, a tourniquet may be used as a last resort for severe, life-threatening external bleeding that cannot be controlled by other methods. When applying direct pressure, place a clean dressing over the wound. Apply firm, steady pressure, and if blood soaks through, add another pad without removing the first one. For elevation, raise the injured area above the level of the heart to help slow the blood flow and reduce swelling. This can be combined with direct pressure. Pressure points are areas where an artery runs close to a bone and can be compressed. This temporarily reduces blood flow to the limb, aiding in bleeding control. If bleeding is severe and direct pressure or elevation fails, or the wound is large, the patient should be treated for shock. Call for emergency medical help immediately. Internal bleeding, as seen in bruises or from organs, requires urgent medical attention. Signs include pain, swelling, tenderness, or blood from body openings. Management for internal bleeding involves calling for medical help, monitoring the patient's breathing, and treating for shock while waiting for professional help to arrive. Hemorrhage can also be classified based on where the blood exits: external, internal, or externalized, such as blood coming from the nose, mouth, or ears. A hemorrhage is a rapid loss of blood from a body part, and it may be categorized by the type of vessel damaged: arterial, venous, or capillary. Another type of hemorrhage classification is based on the time of occurrence. Primary hemorrhage occurs immediately after injury, reactionary happens within 24 hours due to blood pressure changes, and secondary occurs 7 to 14 days later, often due to infection. First aid aims to stop the bleeding, prevent further infection, and manage shock. Remember to ensure your own safety first before approaching the casualty. The principles of first aid for bleeding involve direct pressure, elevation, and pressure points. Treat the patient for shock and arrange for transport to a medical facility. In summary, prompt and effective first aid for wounds and bleeding is crucial in saving lives and preventing complications. Remember to prioritize safety and seek professional medical help immediately for serious injuries.